Hello everyone, I'm Jawad Bilal. I'm from University of Arizona and I'm here at RWCS. I will talk about my recent project which I published in JAMA in October 2019. So we are looking at the risk of serious infections, opportunistic infection and cancers in patients who are taking interleukin inhibitors for rheumatic diseases. There is the therapeutic efficacy of the interleukin inhibitors is very well established, but there is positive data regarding the safety profile, particularly with regards to serious infections, opportunistic infection, and malignancy. In this systemic review and meta-analysis, we aim to evaluate the risk of these particular safety outcomes, our data sources included the randomized placebo-controlled trials which evaluated the interleukin inhibitors. We included interleukin 1 inhibitors, interleukin 6 inhibitors, interleukin 12, 23, interleukin 17, and interleukin 23. So if I talk about the results of this meta-analysis, so I'm gonna show you that this is the odds ratio for the risk of the cancers. You can see there is a reference signs of 1, and then you can clearly see that the cumulative odds ratio, overall odds ratio is 1.51, which is more than 1, which is showing that there is increased risk of cancers when you take interleukin inhibitors compared to placebo. Then if you move towards opportunistic infections, this is the reference line 1, and then you can see cumulative odds ratio. It's on the right side and not crossing the 1. It's 2.34. So there, the odds ratio showing that there is increased risk of opportunistic infections when you take when patients take interleukin inhibitors compared to placebo. Then if you move here, so this forest plot is showing the risk of the serious infections. So you can look at this cumulative odds ratio, and it is actually showing that there is the risk is 1.9 percent increased in the patients who are taking interleukin inhibitors compared to placebo. So overall, where our meta-analysis showed that there is increased risk of serious infections, opportunistic infections, and cancer in patients who are taking interleukin inhibitors compared to placebo. And then the results were at least, by grade approach, they were at least moderate certainty, and the results of the subgroup analysis were robust too. But our meta-analysis is not without limitation, particularly regarding the risk of the cancer, because the risk of the cancer, which is have showed increase in this meta-analysis, is not definited, and we will need the real-world data before we can make definitive conclusions. And I would say that this meta-analysis can provide the toxicity estimates when we are trying to discuss the risk and benefits of the interleukin inhibitors for rheumatic diseases, and patient and physician can take some informed decision before starting these medications. Thank you.